Mr. President, when it comes to health care, Democrats and Republicans all agree that we need and we want health care reform. Having practiced medicine for over 2 decades in Wyoming, I know that doing nothing is simply not an option. But let me tell you from experience, the devil is always in the details. We must be careful, we must be thoughtful, we must be deliberate about the changes that we make. Health care is a very complex and an intensely personal issue. It deserves a serious, open, and a transparent national debate. Any changes that Congress makes are going to impact millions and millions of American families. These are people of our nation. These are not nameless or faceless statistics. These are husbands, mothers, neighbors. These are our wives, our friends, and our coworkers. These Americans are our children, the nation's most precious resources. We must act, but still at issue is whether Congress will act without sacrificing our health care system's greatest strengths. And what are those strengths? The freedom to choose your own doctor, the freedom to choose the hospital that you want, and the freedom to choose the health care plan that fits you and fits your family's needs. Mr. President, I travel home to Wyoming every weekend. I was there yesterday, and one of the top issues that I hear about is health care. The people of Wyoming are concerned about the cost of their health care. Many families worry that they will lose the health care coverage that they currently have. Still, others can't afford health insurance at all. This is what's wrong with the current health care system. This is what we need to fix. Wyoming families want to purchase health insurance coverage at an affordable price. They do not want to be denied coverage because of pre-existing conditions. They don't want to lose coverage if they change jobs. But most of all, these families do not want Washington telling them who they have to see for their medical care. Everyone should have the freedom to choose the doctor, the hospital, and the health care plan that they want. No Washington bureaucrat should ever be allowed to deny that right. Now, some in Congress continue focusing solely on government solutions. They want Washington and its enduring wisdom to take over health care. Some in Congress want to create a government-run health care plan. Their plan creates a government-run insurance model that could limit patient choices, eliminate personal freedoms, and decrease the quality of care. What starts out as one option could quickly lead to being the only option, and we all know how this happens. Unlike regular health insurance, government health plans have unlimited access to taxpayer money. Could use the money to temporarily subsidize the cost of services. But ultimately, someone must pay for the care. Now, according to the Lewin Group, 119 million Americans would lose the private coverage that they currently have if we have a government-run system. Now, I know some in the Senate and the administration keep saying, if you like your insurance coverage, you will get to keep it. The Lewin Group data provides otherwise. Their study shows businesses will face a situation where it's cheaper for them to insure their employees through the government-run plan. So employers will then transfer their workers from the private insurance that they currently have and that they may like to this new Washington-run government plan. So where's the personal choice? At this point, the individual has no option. The government-run plan is their option, is their plan, unless that person changes jobs to an employer who is willing or can afford to offer private coverage. So what happened to the, if I like my health insurance plan offered by my employer, I would be able to keep it? Well, that promise is out the window. Now, some say we can create safeguards that will ensure a level playing field between private insurance and a government-run plan. Well, as a doctor, I can tell you from personal experience that the government will never, ever compete on a level playing field with private business. Washington will never let its health care plan go bankrupt. Never. It'll lose money, it'll hide costs, and ultimately taxpayers will pay the difference. Private plans will not enjoy this same kind of support. That is exactly how the heavy hand of government can drive out competition. So, how does government compete with private business? Well, Congressman Mike Pence of Indiana summed it up pretty well. He said the government competes private business the way an alligator competes with a duck. Supporters of the government-run Washington takeover of health care say the plan will keep costs low. How? By paying hospitals, doctors, nurses, home health agencies, hospice providers, and long-term care facilities less than private insurers pay. Hey, this should sound familiar. This is what already happens with Medicare and with Medicaid. Any participating Medicare or Medicaid provider will tell you that today, right now, doctors and hospitals have to shift costs onto private insurers just to keep their doors open. The cost shift to make up the difference between what a procedure costs and what the government is willing to pay for it. That's what they call cost shifting. We see it every day. A government-run plan will not encourage competition. It will take away your access to private health insurance. The private plans that millions of Americans have today, the program that they like, the one that they want to keep, will be gone. The only choice remaining will be the government plan. So what does this all mean to, someone who's listening in, to the patient? Well, it means politicians making health care decisions, not patients making those decisions with their doctors. It means Washington bureaucrats deciding if you can have the hip or the knee procedure that you need. It means the government saying you cannot have life-saving medical treatment because it's too expensive or because you are too old. It means Washington restricting you and your child's access to the most advanced medical testing equipment. It means preventive testing delays. It means diagnosis delays. It means treatment delays. Delayed care is denied care, and we do not want that in America. Take a close look at what is going on in Canada right now. Last year in Calgary, ophthalmologists, eye doctors, there was no waiting list for people needing cataract surgery. Then Alberta's cash-stripped government made a decision. They made a decision that they said, hey, we're going to arbitrarily lower the number of cataract operations that we pay for. They just arbitrarily said we're going to pay for 2,000 fewer cataract operations this year in Alberta than we did last year. So what does that mean for the people there? Well, many patients now have to wait a year for treatment, a year. Why? Well, the cutbacks forced surgeons to cancel all of the operations that they had scheduled on people with moderately severe cataract conditions. So now they only book the most severe cases. Ophthalmologists are now concentrating their efforts only on the patients who are about to go blind. Not the people who have a hard time seeing, the people about to go blind. Patients living in Alberta have to almost be going blind to get cataract surgery. Is that the kind of medical care that we want for Americans? Absolutely not. America should strive to offer its citizens the highest quality, most timely health care services in the world. That means that Americans should not have to wait weeks at a time for tests and treatments they need. It means no one should be denied health care services because of government limits or government restrictions. It means no government bureaucrat should interfere in the doctor-patient relationship. Currently, the Senate Health Committee has been debating a health reform plan that's been put forth by Senators Kennedy and Senator Dodd. Well, the nonpartisan Congressional Budget Office told us that the Kennedy-Dodd plan increases spending by more than $1.3 trillion in the first 10 years. Once it's fully operational, a 10-year fee would be closer to $2.6 trillion. The number was staggering. People cried, sticker shock. So what did they do? Well, they tweaked it around a little bit and came out with a new estimate. Well, they're just guessing. Even more disturbing is that the plan is incomplete. The Congressional Budget Office still has additional policies to score to come up with a price tag on. Clearly, this estimate does not reflect the bill's true cost because they left out Medicaid, something that they've been forcing on to the states. And governors all around the country have been crushed by these Medicaid increased fees and increased expenses. So 10 years, trillions of dollars. Congressional Budget Office also tells us that this plan only reduces the number of people who do not have insurance by 17 million. That leaves over 30 million Americans still without health insurance, and they're spending $1 trillion. Finally, the Congressional Budget Office indicates that about 15 million people would actually lose the insurance that they have now, be forced off of their employer-paid-for insurance under this $1 trillion plan. Well, this, to me, this Kennedy-Dodd plan suffers from what I call the 3 C's. It costs too much, it covers too few, and it causes too many people who already have insurance to lose the coverage that they have. Now, some in Congress believe that unless we completely dismantle the current health care system and build it up in the image of big government, well, then reform, they say, is simply not worth doing. I disagree. Americans do not want the same government bureaucracy that has given us the Department of Motor Vehicles, do not want those people controlling our medical decisions. Americans do not want increased bureaucratic hassles, we don't want long waits, and we don't want restrictions on our medical care. What we need is a serious, transparent health care debate. That's what Americans want. They want us to listen to their ideas, their concerns, their suggestions. The only way they can give us their ideas, concerns, and specifically their conceptions about their suggestions about a health care bill is if they actually get to read the bill. Whether or not we should reform our health care system is no longer in question. Americans have answered with a resounding yes, and they don't want to continue to wait. They want simple, practical, affordable changes now. Changes like prohibiting the use of pre-existing conditions. Changes like allowing people to take their health insurance with them when they switch jobs. Madam President, you have a young family, I have a young family. They're going to have 7 or 8 jobs over the course of their lifetime. They need to be able to take their insurance with them. We need to have changes like offering premium breaks for making healthy lifestyle choices. Changes like the same tax breaks for people that buy their own insurance that the big companies get when they pay for insurance for their employees. We need families to be able to have those same tax breaks. And we need changes like allowing people to shop across state lines to look for better deals and keeping their costs down. I want to continue to come forward with common sense ideas. I want the majority in Congress to work with me and with members of my party on a bipartisan health reform plan. That's the need. That's the need that the country is expecting. That's what I would like to do. We cannot simply put government in charge of health care and put bureaucrats in between patients and their doctors. With that, Madam President, I yield the floor and suggest the absence of a quorum.